Yeah, hello everyone. My name is Qian-Yi, and today I will be presenting one type of diagnostic medical imaging, which is mainly known in pregnancy test. Its name is sonography. First, let's talk about how it works. So sonography is an essential and exciting application of physical principles. It uses a pulse echo technique. A high-frequency sound pulse is played into the body, and its reflection from boundaries or interference between organs and other structures and lesions in the body are then detected. We could use this technique to get tons of information about many organs in real life, meaning that the ultrasound images are like a movie for the area that device is detecting. The pulse echo technique for the medical imaging is shown in this image. The ultrasound pulses are emitted by a transducer on the left that transform an electrical pulse into a sound wave pulse. Most pulses pass through the body. The rest of the pulses are reflected as echoes when they touched other surfaces in the body, such as the organs and the vertebra. The same transducer then detects these echoes in order to create real-life images. So from all these imaging techniques, X-rays, CTs, MRTs, why do we choose sonography? What are the benefits? Well, first, the benefits is already mentioned earlier. Sonography is capable of showing the movement of the veins and organs in real time. This is exciting because we could see a lot of abnormal stuff in our body using sonography, like tumors and pockets of fluid. The second benefit is that sonography has no or very little harm to human body, unlike other typical diagnostic medical imaging like X-ray and computed tomography, or in other words, CT. They all have radiation. And for those non-radiated, like MRT, it has magnets, and sometimes it will be harmful to people, and it has limits. Third, ultrasonography is cheap and easy to do at any time. So sonography really stands out when diagnosing and analyzing illness with affected organs and veins. Therefore, in this pandemic of COVID-19, pneumonia, sonography is used to diagnose patients and analyze the lungs condition. The table below from a report by Qian-Yi Peng shows that both CT and ultrasound are used for COVID-19. Furthermore, the report recommends using sonography to make a rapid diagnosis first, and then do a CT test if more information is required. As we can see from the table, both CT and ultrasound are capable of determining the pneumonia from COVID-19. And another report by Zhaoyu built a model for evaluating the severeness of the COVID patient's lungs using ultrasound. The author of this report created a model called MCRF-NET to improve the diagnosis of COVID pneumonia. As a result, it works. As we can see from the table right here, at the bottom right, the diagnosis with MCRF-NET has an accuracy of 94.39%, a precision of 82.28%, a sensitivity of 76.27%, and a sensitivity of 76.27%. Of 96.44%. And these values are all higher than all the other models, which shows that ultrasonography is essential for fighting COVID. And of course, COVID-19 is not the only disease that ultrasound fought. Cervical cancer, unlike the recent COVID-19 pneumonia, it's not some new disease. It actually has a very long time history. Therefore, doctors have more experience diagnosing and treating this disease. In fact, there are two approaches that ultrasound could help fighting cervical cancer. The first method is using pelvic ultrasound, which is the same kind of ultrasound that the doctor used to treat COVID. The second method uses Doppler ultrasound, which uses ultrasound waves to vibrate organs and the veins to determine the blood flow speed. The pelvic sonography is used to determine foreign matters in human bodies. In this case, it is used to find tumors. And since from one of my textbooks, tumors are grown from a single cancer cell and then invade neighboring tissues. They tend to influence the speed of the blood flow. In this case, the Doppler ultrasound will be very, very useful to locate the irregularities in the blood flow and therefore find the cancer cell. The report from Dehong present that and I quote, the transvaginal color Doppler ultrasound, which is also called TVCDFI, can accurately reflect the size of the lesion, the extent of the infiltration, and the blood supply. Moreover, the author also proves that Adler grading created by the Doppler ultrasonic sonography gives sufficient information for cervical cancer diagnosis. And here are some Doppler ultrasonic sonography images of cervical cancer. Here they are. The images A, B, C, D corresponding to Adler grades of 1, 0, 1, 2, and 3. And they are related to the stages for the cervical cancer. Although we cannot understand these images, we're not professionals, but a professional sonographer will quickly identify the cervical problems. Therefore, ultrasound also plays an essential role in the combat between humans and the cervical cancer. And what are some similarities in the utility of sonography between COVID-19 and the cervical cancer? Well, since sonography is one of the medical imaging techniques, doctors and sonographers use sonography for diagnosing and gathering information for both diseases. They are the same. And another interesting similarity is that sonography is still developing when treating patients with COVID, pneumonia, and cervical cancer. A novel and a better model for the diagnosis of COVID-19 named MCRF-NET is created in the report by Zhaoyu. On the other hand, the report by Dehong shows possibilities for utilization of a Doppler ultrasound for clinical management. In other words, sonography has potential in both disease treating. However, it requires more time for development and improvement. And now, after the similarities of the two diseases, let's talk about their differences. First, doctors use different kinds of ultrasound imagings. When doctors face COVID, they use pelvic sonography and to determine if the lung is abnormal in an abnormal or normal state, or if there's any lung damage. And when they face a cervical cancer, they use mainly the Doppler ultrasound to test the blood flow condition to determine the place for the cancer cell. And second, the objectives of the imaging are slightly different. Doctor wants to see the status of the lung when treating COVID. And on the other hand, the blood vessels are more focused during the sonography in the cervical area. In conclusion, ultrasonography is a medical imaging method that uses waves transmissions and reflections to draw interior body images in real time. The ultrasonography was applied to diagnosis of many different diseases. It is cheap, not time-consuming, and easy to reuse at any time. In treating COVID-19 pneumonia and the cervical cancer, ultrasonography has potential, but still needs time to enhance itself. And then here, my works cited. Thank you very much for your time and take care of yourself. Be well.